It might be carried forward to the doctors also. So it's a metabolic problem which involves many organs like it can lead to diabetes also, and it can cause heart diseases also. And it's a ovarian disorder which affects the reproductive system, and basically it causes hormonal changes. उसकी वजह से hormones की वजह से there is a problem with the androgens and the estrogens and the hormones. And because of that, there's a disturbance in the menstrual cycle. Because of all that, it's just a vicious cycle which goes on.
Obesity, PCOD, PCOD, obesity.
Baat toh sahi. 7 to 8 years girls are also menstruating, and they are also exposed to all kind of lifestyle factors. The normal pattern of hair growth is regular cycles. Like girl might be having some long cycles. Keep them out or keep them busy with this as a symptom.
सूर्योदय में खाना शुरू करो और सूर्यास्त का खाना बंद करो.
Body shaming बहुत होती है जब teenager becomes obese and all because of hormonal disturbances.
तो उस तरीके से हम एपिसोड ऐसे चलेंगे. आई एम इन माई लेट 30s और बहुत ज़्यादा हेल्थ के लिए कंसिडरेट होती चली जा रही हूँ क्योंकि बहुत चीज़ें सफ़र कर रही हूँ और बहुत चीज़ों से बचना भी है. तो इसलिए आज का पॉडकास्ट है. इट इज़ विद अ मेडिकल प्रैक्टिशनर गायनेक डॉक्टर शिवाली गोयल, एंड वो हमें आज पीसीओडी के बारे में बताएंगी. तो अगर आप अपनी हेल्थ के लिए कंसिडरेट हैं, अपने बच्चों की हेल्थ के लिए कंसिडरेट हैं, तो आपको ये पॉडकास्ट ज़रूर देखना चाहिए. कोशिश करेंगे और भी अच्छे अच्छे पॉडकास्ट लेकर आने की, कुछ फनी, कुछ सीरियस इश्यूज, कुछ इन्फॉर्मेटिव चीज़ों के बारे में बात करने के लिए. तो पॉडकास्ट को मिस मत करिएगा और कुछ भी अगर आपके क्वेश्चंस हैं तो कमेंट सेक्शन में ज़रूर लिखिएगा. एंड वी आर वर्किंग वेरी हार्ड. तो अगर आपको हमारा हार्ड वर्क पसंद आए तो डू कंसिडर सब्सक्राइबिंग और फॉलोइंग आवर चैनल. तो लेट्स स्ट्रेट अवे हेड टू द पॉडकास्ट. बात तो सही है. So let's start and talk to our expert, Dr. Shivali Goel. She's a practicing gynecologist at 𝐻 Hospital. कैसे हो आप?
I'm fine, thank you, Mehan.
So मेरा पहला क्वेश्चन आपसे है कि what exactly is PCOD?
PCOD means polycystic ovarian disease, and it's a ovarian disorder which affects the female reproductive system. And basically it causes hormonal changes. उसकी वजह से hormones की वजह से there's a problem with the androgens and the estrogens and the female hormones. And because of that, there's a disturbance in the menstrual cycle. Because of all that, it's just a vicious cycle which goes on.
PCOD और PCOS हम बहुत ज़्यादा सुनते हैं. तो इन दोनों में डिफरेंस क्या है?
PCOD is polycystic ovarian disease and PCOS is polycystic ovarian syndrome. PCOD is basically a more common phenomenon and PCOS is a rare problem. PCOD is affecting the ovarian disease. It's an ovarian disease. While PCOS, that is a metabolic problem. And it is linked to the genetic or it is hereditary, we can say. That if the mother is having some PCOS problem in her reproductive age, then it might be carried forward to the daughters also. So it's a metabolic problem which involves many organs, like it can lead to diabetes also, and it can cause heart disease also. So but the PCOS definitely rare other than this. Worst cycle of PCOD can be converted into PCOS also. It is a very rare thing because it's a break the cycle in between. It is because PCOS is always rare. So only 2 to 3% cases of patients are having PCOS. PCOS from reverse person. PCOD can be reversed, but PCOS because it has gone into a first leg syndrome. It is difficult, but it's not impossible. So what do you think? It's a lifestyle है हमारा आजकल बच्चों का. We are seeing teenagers maybe I think PCOD is attacking nowadays. PCOD जो है वो basically 15 to 45K stroke affect करते हैं. Okay. Definitely teenagers are getting involved because of the lifestyle problem. And there's a lot of stress and unhealthy diet because बहुत सारे children they come with the mother especially they have a problem कि my children, my daughters are having junk food. So that is why because of unhealthy diet, by sedentary lifestyle, and because stress, how much stress is there nowadays. So all these 3 factors causes PCOD. Like they may be hormonal disturbances which lead to PCOD. What your experience says about this? Last 10 years, Mika, is it increasing? It has increased because menstruation that was normally it was 11 to 12 years. But now it has shifted to 7 to 8 years. Like 7 to 8 years girls are also menstruating. And they are also exposed to all kind of lifestyle factors, so much of social media, stresses, peer pressure is also there. So because of that, we are seeing, and because of Zomato, availability of the outside food at your tips.
Availability of, I think everything on like fingertips. चाहे वो social media हो या खाना हो, like everything.
But how much the contribution of the disturbed sleep cycle? Like in 12-1 बजे के बाद we are getting a month definitely because sedentary lifestyle again, you are living a disciplined life. Like जब हम लोग स्कूल में थे, so like we had NCC, all that training programs were there. So we used to live a very disciplined life, like getting up early in the morning and we exercise, giving time to your body. I'm eating good food and good meals, homemade foods and all. So definitely if you break that pattern, definitely hormones will be affected. And then see, because of the hormonal imbalance, because PCOD is definitely a hormonal imbalance. So because of that, वो हमेशा गड़बड़ करेगा, sleep cycle भी अगर disturb है, तो ultimately what you say, one is not following the disciplined life.
So what eating habits one should have? कि मतलब ये चीज़ खानी चाहिए, अगर हमें कंट्रोल करना है, या ये चीज़ नहीं होनी चाहिए, तो क्या खाना?
Basically, again, homemade food, I will always suggest you can have at least 6 days in a week. You should have homemade once a year. Once a week, you can have an outside.
Cheap ways. Like
Nowadays, I've seen that a lot of teenagers, they come and they are 3 days they are having outside food, and which contains a lot of fatty, oily, definitely the processed food.
क्या घर का खाना होता यही है, तो फिर कैसे बचे?
You have to be a little bit strict with the children, because what happens if you are not strict? Otherwise, all will lead to because PCOD ultimately will lead to PCOS, and that has a risk factor for hypertension, diabetes, heart diseases, endometrial cancers, obesity. Obesity itself will cause more of heart problems and all. It's like आपने शुरू में करवा होता है, इन बाद में वो फायदा भी करते हैं. तो it's like parents का जो advice शुरू में करवा नहीं था. But ultimately, she will feel कि हाँ पे was the right advice, and she will start feeling that because body shaming बहुत होती है जब teenager becomes obese and all because of hormonal disturbances. उसकी वजह से जो है वो body shaming होगी, उसको भी आप खुद anxiety होगी कि क्या हो. बात भी सही है.
I have also seen कि teenagers होते हैं वो extreme dieting पे चले जाते हैं. And extreme means extreme dieting. जो बोलते हैं कुछ भी नहीं खाना. Then again that is also not correct. So एक हमें एक stage पर आना चाहिए जहाँ पे healthy भी खा रहे हैं, cheat meals भी दे रहे हैं.
Actually, I feel that communication is a basic problem nowadays, and really, as mothers also, we are so busy in our own world. Keep everything. We as parents also don't have time to look after the children, what they're eating, where they're going, and we must just keep them out, keep them busy with this. God. We are neglecting our children. मोटे तो वो PCOD का क्या, अगर आप ली रहे तो भी हो सकते हैं. कई बार आप सोच लेते हो कि मुझे तो हो ही सकता है because I am तो underweight. See, because PCOS is a metabolic problem. It is related to genetic. Okay, so patients who are genetically or who can inherit from their mothers, those patients who are thin but also might be possible that may develop PCOD. Otherwise, पति लोगों में chances कम है. And I think this is vice versa. आप मोटे हैं तो PCOD और PCOD के बाद फिर मोटापा बढ़ना है. Like a vicious cycle. Because hormonal imbalance, because of the increase in the male sex hormone, increase in the androgens that causes a lot of acne or ectoderm, excessive hair, body hair, male type of balance is there. So because of the increase in the androgens, there is hormones drop. So what are the early symptoms? Like initial symptoms को जिनको notice कर सकते हैं, जो अक्सर ignore करते हैं. Normal pattern of hair growth is the most important thing. Secondly, there will be irregular cycles. Like girl might be having long cycles. 30 days plus minus 7 days is considered normal. More than that, then it is considered prolonged. If it is associated with other symptoms like acne or hirsutism, and it is not only for normal cycle, the menstruation pattern might be heavy also or towards the lesser side.
And what are the extreme symptoms? कि मतलब अब ये हो गया है तो अब तो डॉक्टर को दिखाना ही पड़े.
Even if you are maintaining the normal diet pattern, very well you cannot think like this. इस बार शायद CVD लोगों को because I was stressed. इस बार I was on medication for other things. 5-6 months के you are just ignoring. कि बरसात की वजह से बाल झड़ रहे हैं, उसके बाद सर्दियों में डेंगू पैसे बाल झड़ रहे हैं. Should not happen continuously. And the most important thing, what are the chances of conceiving if you are having PCOD? Definitely 10-20% patients of PCOD are infertile. PCOD is actually a very treatable disease, and if you maintain the good lifestyle, exercise regularly, maintain a good diet, and with few medications also, your periods can get regular, and if you are maintained on that, then PCOD is very easy to treat if the patient is infertile. Because she's having irregular cycles, eggs are not released, and that is when the patient is having infertility. But with medication support, with side support also, the PCOD patients get conceived. Initially stage में भी हमें medicines की जरूरत होती है, या हम थोड़ा lifestyle change कर रहे हैं, we focus upon the good health, it will do. And what other stages पे जब आप चलो hormones को therapy देते हैं, cycles के लिए much, because increase in the main hormones and estrogens, and there is an insulin resistance also because of increased insulin is there. So blood sugar levels also go high. So because of the sugar levels are high, the patient is prone to diabetes. So because there is a insulin resistant to the cell. Insulin is not able to reduce the sugar levels, and that is why the insulin becomes high. And when the insulin is high, the sugar levels are also high because the cells are resistant. So that when the patient is diabetic, like she is prone to diabetic, so that time we can give the anti-diabetic drug which is called metformin. At the time the patient loses weight, we give hormonal support, and once the BMI becomes normal for that patient, we stop the medication, and then we try to see how much the patient is benefiting without any medication. But she must continue with that lifestyle, because for 6 months you're falling, and I suppose if you go to college and you forget everything, and again that patient will come back, teenagers for कैसे motivate us. I think awareness programs should be conducted at schools and colleges. Actually, the parents need more awareness rather than children, because as parents, they check the child at an early age. Then, okay,
ऐसा स्टीम में देखे हैं बहुत सारे पेरेंट्स, उनको नॉलेज नहीं होती है, बल्कि आज तक इतना ज़्यादा इन्फॉर्मेशन है, उसके बाद भी वो नॉलेज नहीं लेने आ सकते. वो जब पेरेंट्स ने भी
मैं चाहती हूँ, but they don't want from me. But ऐसे ही possible है कि I'm not having a symptom even then I'm having PCOD. Yeah, the day one patient came, and her daughter was just obese, and she said, I might be having PCOD, please check up. How should I check her? Like, there is no other symptom. Her cycles are really on, there is like no excessive hair, it's just obesity cannot, it says a risk factor, but one factor is not there in diagnosis of PCOD. We have multiple tried, and then only enable the patient has PCOD. Uski hum ultrasound karana padta. I think basically you should consult a doctor, a gynecologist, for the medical test to be done. And the commonly test basically are like fasting insulin, fasting blood sugars, FSH, ultrasound. Definitely you have to go for the ultrasound. If the child or those symptoms fit into that drive, then only you should go for an patient. So it's ज़्यादा रेज हो जाते हैं, especially cases, and they were main androgens increase होते हैं, and there is a complete cycle जिसकी वजह से कि एस्ट्रोजेंस भी ज़्यादा होते हैं. ओके, तो डेफिनेटली, एंड जो भी हम लोग पिल्स दे रहे हैं, वो सभी पिल्स दे रहे थे. ओके, सो दे कंटेन वेरी मिनिमम डोज ऑफ एस्ट्रोजन टू रेगुलेट द साइकिल, पिट्यूटरी साइकिल. So that is why we have to give some minimum amount of estrogen, but we cannot take those food which contains high amount of estrogen.
इसका कुछ मेडिकेशन वगैरह भी आप सजेस्ट करते हो
क्या? तो उसके आज to medication is regular, but she is losing the weight and no strict diet. So we give her hormones.
एंड उनके भी आफ्टर इफेक्ट्स हो सकते हैं मेडिसिन के. So what are usually after effects?
See, side effects of OCP, because we are getting OCP, so we work on the cycling pills. So it should reduce the hair growth and so we get minimum doses depending upon the weight of the patient and for how much risk factor she might be having. Suppose if her mother is diabetic, if mother is having heart disease, and she also has a history of illness, so we have to be more careful. So marketing is home cooked food. So problems of what I am facing with my clients basically was helping with PCOD. They say कि घर का बना हुआ समोसा, घर की बनी हुई कचौड़ी, घर की बनी हुई मैगी, छोले भटूरे, छोले भटूरे, every single day they can eat that.
बात तो सही है, घर के तो ये सब चीजें खा सकते हैं.
मैंने वो एक दिन छोले भटूरे, एक दिन and I'm once in a week. घर का बना हुआ week. हाँ, once in a week you can.
तो स्विगी और रैपिडो कैसे चलेंगे? जैसे मेरी एक फ्रेंड है, वो अगर हम उसके यहाँ जाते हैं तो पहले वो अपने घर में बनाती थी. When she got married, तो अब वो सुबह स्विगी, दोपहर को जोमेटो और रात में डिसाइड होता है कि स्विगी से अपटक करेगी, जोमेटो से करे. सो ये लाइफस्टाइल पैटर्न यूजुअली एनसीआर, दिल्ली रीजन मेट्रो से बहुत ज़्यादा हो गया.
Since very long. Because जब भी मेरे पास पेशेंट्स आते हैं सबसे ज़्यादा तो मदर्स को डांट पिटती है. आपने ना CIT, you have to be little bit strict to your children. But मेरे क्या होता है? ये सब problems हैं, and it is not PCOD, है other problems all over in the whole body, and intestines are suffering, the heart is suffering. Even the heart attacks have become common in young patients also. It's more common in between 20 to 40 years old.
हाँ, अभी न्यूज़ में मैंने recently देखा था 15-year-old.
Yeah, 15 years. I'm shocked because of so much of alcoholism, smoking, unhealthy lifestyle, because of paper and junk foods are getting in the market, and because of that, we are having so many problems. It's not only PCOD. PCOD is a very minor issue. You look through the whole body, affecting each and every part of yours.
But I have seen people कि बिल्कुल ठीक हो जाते हैं, मतलब hospitalized तक हो चुके हैं, ठीक होकर आ गए हैं, and again back to this normal lifestyle. It's the claim normal, लेकिन normal नहीं है actually. बट उनको लगता है नॉर्मल लाइफ स्टाइल है, तो दोबारा से वो एक साइकिल शुरू हो जाती है उनकी.
But basically, I think now nobody is cooking at home and nobody is doing one so down. It has become an American style of how, right? And people, mothers nowadays say कॉल अप करके कुकिंग तो नहीं आती भाई मेरी लड़की को, इज ऑल्सो प्राउड ऑफ इट, बट देयर इज नो नथिंग टू बी प्राउड ऑफ इट, बिकॉज अगर आप कुकिंग खुद नहीं करे तो आप किधर पे ग्रेट कुक हो, you can't eat it direct. Be how much oil you shouldn't, they just focus on the taste bud. I think eating timing for also plays very important.
But I think usually बात है कि सूर्य होते पे खाना शुरू करो और सूर्य अस्त पर खाना बंद करो.
It becomes difficult for those who are working for the MNCs and working till the 2 or 3 o'clock in the night. So then I definitely feel hungry, not necessarily because I am also a doctor. Now that I just feel on by this is okay. And it's not कि अभी से चलता है. One day मैं लगाने का टेस्ट चल रहा है. I was first year MBBS also. Yeah. तभी meeting भी I said ऐसे था कि 3 बजे तक आपने खाना. लेकिन मेरा जो eating habit pattern था वो कभी भी ऐसा नहीं था कि मैं रात में खा रही हूँ, because आज मैं girls बना के बता रही कुछ खवाए. And the whole night they were used to eat. एक घर में ऐसा नहीं होता था, तो I also never done कि मुझे तो पूरी रात खाना है. 8 o'clock तक I should have my dinner. After 10 o'clock I cannot have it. Ever adverse even if I have awake the whole.
लेकिन अगर हम जैसे रात को सपोज खाते हैं और लेट नाइट जगते हैं तो भूख तो लगती है, डाइजेस्ट हो जाता है, सब भूख तो लगती है.
Depends upon your working.
So basically जब आप माइंड से खाते हो,
say the time to control is only the own body is control. Baat toh sahi. Why do you have 5 senses? Right. 5 senses to control when everything is control. So one day you are eating, how can we eat after 7 or 8 o'clock? You're less free or them. They're less in the day. But they start eating red by 7 minutes.
you taste what is it to make it taste much so resting there.
Children must be taught yoga and meditation.
Exactly.
That will control us. I thought we gave interesting stuff to share 𝐤𝐤𝐤 जहाँ we will buy with because we're making
कैसे क्या हाँ होते हैं उनका कुछ इंटरेस्टिंग सा टेस्ट.
So basically जब मैं बोलती हूँ कि you should not eat outside food, or my daughter and for 3 months they were following the plan according diet plan according to them. But when I asked what you were eating homemade food, so they said कि नहीं हम तो नहीं बनाते हैं, समोसा बना लीजिए. अब जाने में लगा all of the chips बनाने से it was like the increased her weight more rather than reducing it. So we use eyes good which is या deep fry चलना चल रहा है या air fry चल रहा है. So that is also a very common mistake that I'm like, because normally patients feel stand नहीं कर पाते ठीक से, या they don't want to go to the dietitian. I feel like so I take it because I'm मेरी
खाना है ना जी बच्चे का हल्का कुछ अच्छा हमारे
नहीं तो कुछ अच्छा क्या ना है. So that is a very common. अगर तो
आपका दादी का प्यार जो बच्चा तना हुआ निकलेगा अपना तो कैसे दिखेगा. एंटी डॉक्टर थैंक यू सो मच, और आपने हमें इतना गाइड किया. PCOD की बिल्कुल नॉलेज नहीं थी और आज काफ़ी ज़्यादा नॉलेज है हम सबको.
एंटी डॉक्टर थैंक यू.